Let's talk about silicone and saline breast implants and some of the differences. I'm Steve Goldman, board certified plastic surgeon, board certified facial plastic surgeon. All right, silicone. This is a gummy bear Sientra silicone implant. Gummy bear is not a medical term, but it means this silicone tends to be cohesive. It sticks to itself. When I poke this implant, all right, that's actually a bigger hole than may result from wear and tear in the body. But you can see when I poke a hole in the implant, that silicone does not come out easily. So if somebody does get a tiny little pinhole over the years, it's hard to even get the silicone out. So what I'm going to do is squeeze really hard, and you can see this little tiny drop of silicone bubble out. And when I let go, it gradually pulls back into the gummy bear implant. That does not mean gummy bear implants don't leak. They still leak. They still have to be replaced if they're leaking, but it does mean that the leak is a slow, gradual process. And in fact, neither the patient nor the surgeon generally recognizes a silicone leak, probably for a year or two or sometimes more. But if any patient notices a change in their breast, how it looks, how it feels, they should return to their surgeon. Silicone's not toxic. There's no evidence that it's toxic. However, if it does leak, the body may try to wall off the silicone over time, so you might get a capsular contracture, thickening of the scar tissue around the implant. So, gummy bear silicone takes a long time to leak out of an implant. That also means that periodically, patients should get MRIs of the implant to look for leak, because that will show a leak before you or I can tell it's there. Saline. The most common reason for somebody to have a leak is if a fold develops in the implant. A fold can cause a corner, which causes stress on the implant shell, which eventually can cause a pinhole. That's the most common cause. I'm going to poke a hole in this implant, and when it sits there, you don't really see it, but I did just poke that hole. But now it's a little fountain, right? So if somebody gets a little hole in the implant, they will pretty rapidly deflate if they're saline. So generally, when it starts to deflate, it's not an emergency. This saline is salt water. The body just absorbs it. Patients don't notice, but they urinate out the excess fluid. They do notice deflation. Most patients will notice this within a day or two. And it's not an emergency, but we do like to see the patients within a couple weeks swap out the implant within a month or so. Saline, silicone, both can leak. They leak in different ways.